Well, welcome everyone to our second podcast from Pulse of Prevention from our team at Insurance Collaboration to Save Lives, where we dive into data-driven insights that are shaping healthier futures. I'm your host, Mitch Bagley from our team at Insurance Collaboration, and we are diving into the vital topic of women's health, and in particular, putting a spotlight on maternal well-being. I'm joined by Rebecca Ritchie this morning. Rebecca wears many hats from our team at Insurance Collaboration to Save Lives. She works on our product development and innovation teams, and as well as a key contributor to our marketing team. One of the data insights that I want to credit our research team into uncovering is what's going on with disability rates, according to the U.S. Bureau of Labor Statistics. Since 2020, we have seen a dramatic increase in disability across the board, but in particular among those women who are eligible for the workforce and those who are employed. Since March of 2020, it depends on what months you're looking at during that time period, but we're looking at rates up to 40% increases in that time period. And there's nobody better to go over this pressing issue than our guest today, Shelley Schoenfeld from Gomo Health. Shelley is the Chief Marketing and Client Services Officer at Gomo Health. And Shelley, welcome to the Pulse of Prevention.
Thanks so much for having me, Mitch and Rebecca.
Well, Shelley, why don't you provide the audience with a little bit of a background on your background and how you linked up with Bob Gold at Gomo Health?
Sure. So I have spent the duration of my career focused on patient and provider engagement and in a lot of different formats and environments. I started out doing all in person in that regard. And then when the .com became essential to everybody's marketing toolkit, I joined that parade and went into the consumer land of patient education online, and then eventually clinician education, continuing medical, pharmaceutical, and nursing education. And it's really all been about motivating people to take actions. So whether it was consumers to take better charge of their healthcare, or providers to increase their skill set and their knowledge and be up to date on all the latest trends when it comes to patient care. That's really where I've spent the majority of my time and background. And since joining Gomo Health 12 years ago, I have been managing the marketing and client services teams within our organization, which are really obviously all focused on positioning content, information, resources to our audiences in such a way that they feel that they want to engage and ultimately become motivated to take an action, whatever that action may be.
Great. Thank you. Thank you so much for that introduction, Shelley. And we're very excited about a new engagement hub that you all at Gomo Health came out with not too long ago with the Women, Families, and Children Hub. And talk to us, is that a culmination of programs throughout your time at Gomo Health? Is that a reaction to some of the trends that we discussed a little bit earlier? What's kind of the background of the new program?
Sure. So the the ramp up to developing the Women, Children, and Family Hub is that I think we all understand and agree that women have a lot sitting on their shoulders. They are worried about their own care, they're worried about the care of their dependents, and whether that be children or older family members that they're caregivers for, partners, spouses. So they have that whole aspect of their lives. Then they have their professional lives. They want to, of course, have balance in their lives so that they have the power, the energy, the focus to manage all of those different things. So there's a lot going on for women, and it's a complex, complex landscape. So the hub was developed to support women at any stage of their life. So whether it's caring for a child or for a child themselves, because it's a women, children, and families hub. So there's something there for all of those audiences. So for children and teens and adolescents, and through pregnancy and postpartum and midlife and later on in life and dealing with menopause and caregiving and aging. It's a hub, it's a centralized location that can support individuals at any of those stages. And the hub is representative both of the centralized communication and then also of all the different resources that are available to them in that hub. So there's individualized support and messaging. There's a feature, a chat feature, where the participants can communicate with clinicians in a secure environment. There are different devices that can be included where we can get remote monitoring on women, children, and family health. So it's really very much exactly that. It's a centralized hub to provide that support throughout the different stages and with different resources and tools that we have available in our toolkit.
I know and working with Bob and Gary and you for the last 6 or 7 months. I know that one of the first questions I always get when and talking about GoMo Health, and you talk about a message-based system. Is it an app, or what is it exactly that your users are receiving on their phones and other messaging systems?
Yes, the biggest questions we get, Mitch. There is no app. We are not an app. You can't find us in the App Store right now. There's no app to download. It's really what we call a friction-free experience. So the way that we're able to communicate with the millions of people that we do is that we have a science, and I hope I'm not jumping the gun on talking about the science, but we have a
Well,
science and it's called behavioral RX. And it's a proprietary science that we've been developing for many, many years. And it's a science of precision engagement. So without an app that somebody has to go to, download, access in their time of need, we actually are the opposite of that. We go to the person. We have a philosophy that when you're in a dire moment or a challenging situation or dealing with something complex, who's thinking that they want to go somewhere and log into something? Ideally, you want the solution to come to you. You want the resource to be delivered to you. That's really the ideal situation, that you don't have to search it out. And that's what we do. That's how we operate. We go to the person and we do that through our science, which is based on a number of different engagement principles that enable us to learn specifically about each individual in our program and cater the resources and support that we deliver to them based on their needs, their circle of support, their access, the complexity that they have with their issues, and things like that. So, not an app.
not an app, not an app. It took me a little while to get that through my head, but once you could see the upfront, and we're going to show the audience the capabilities of the message-based system. Once you see it in practice and see the alerts that come to your phone, it's really cool to have almost I think Rebecca and I talk about an AI buddy right there at your service. And you mentioned the behavioral RX science-based approach. You want to talk about that a little bit more in detail about how what the process is to actually engage those using Gomo Health Services.
Sure, sure. So we really believe, and I'm sure you all would agree, no two people are alike. Everybody has different things going on in their lives, different stressors and responsibilities and things like that. And we're talking about women's health, even as a mom myself of three kids, three different profiles, three different needs, interests, things like that. So our whole system is based on that principle that no two people are alike. So to treat and communicate and engage with every single person in exactly the same way would be silly because everybody's going to respond to something different. They're going to engage, they're going to latch onto something different. And once they latch on and they believe that the resource of information is credible and that they can trust it, they're going to engage further and they're going to come to it and they're going to look at what's sent to them from that resource and answer the questions that they're being asked. So the whole science, this whole science of precision engagement is structured in a way that we can collect information from the people that we're talking to in order to customize their experience. And then the experience that we deliver is customized for them. So we ask questions, we get information. Our system is entirely bidirectional. So the way that we would talk to you, Mitch, about your mental health issues, for example, would be different than the way we talk to Rebecca, because you both have different things going on beyond your mental health issues. You're not just about your mental health issues. You have family factors, professional factors, psychosocial factors, relationship factors. So all those things are considered on an individual level. And our science has 8 different principles that we leverage to collect that information, build the experience, deliver the experience, and refine it. So for example, we're all about being simple and highly directed. We don't want to talk to people and give them a whole, overwhelm them with the information that we're providing. So we deliver, for example, one thought at a time, one individual idea that somebody can act on. So they can focus, they can direct themselves to that ask, they can respond to it. And when they do, they say to themselves, hey, I can do this. I can be active in my own health. I can manage it. I can do it. I'm building my own confidence. I remember a couple years ago, my mom was going through breast cancer and treatment, and she was dealing with a hospital in New York City, and she's from a small town in Pennsylvania. So already you got the anxiety building and the worry, not just with the disease and the diagnosis, but the travel and the logistics and how am I going to handle it? And she got this packet of information from a world known cancer treatment center in Manhattan, and I came home to help her. The entire kitchen table was covered with paperwork, registration, testing, admissions, the hospital where she was going to be treated, the hotel that they were affiliated with, and how to get there. And she's looking at this table information. And she looked at me, she said, Shelley, how am I going to handle this? How am I going to navigate this? We are that navigator. We take all of that information and simplify it. So you see, talking about my mom, all the factors, the human factors. If that patient was in Manhattan, they wouldn't be worried about travel. They wouldn't be worried about hotel. They wouldn't have that stress and anxiety. So my mom's that, the other individual who has those factors. The Manhattan patient has the other factors. So our science enables us to learn about both of those two people, for example, and build a pathway to engagement and activation that's customized specifically for them.
If I've learned anything in the last 5 years, the top-down approach and making everything the same for everybody is not the way to go about it. And I would say in the timing, like a lot of things in life, timing is everything. When we came across you and Bob and whatnot, we were meeting with dozen insurers, and we had a lot of cutting edge and very impactful research and simple what we thought of simple solutions to address a lot of health concerns. The biggest thing that we kept getting is how do we engage our policyholders? How do we get people involved in actually taking care of their health? And when we met you and Bob and Gary and the entire team, it was just such a refreshing and very inspiring that to see your capabilities and what you've been doing at Gomo Health for so long. Rebecca, why don't you provide a little bit of insight on why we're so excited about our partnership with Gomo?
Oh, sure. Well, I'll never forget one of the first meetings I had with Gary and Bob. They asked me if I could change the minds of millions of people to do something, what would it be? And I thought, golly, what a question. And they're telling me that they know how to do this and be successful at steering people toward those action items that you're talking about. And it was very impressive. And it opened up this whole world of possibilities. And that blank slate, the customizable feature of Gomo is what is most attractive. Because like you're saying, with no two people, especially moms, having so much on their plate and navigating like what you're describing with your mom going through, having a tool like this is just fantastic. And so that's some of the where the excitement I think comes from is that customizable piece and that little navigator that's in your pocket that you can take with you wherever you go. It's just great.
It is. It is. And Shelley, if I could return back to a little bit to the trend analysis that we brought up, not that Men haven't been, the disability rates for men are abnormally high as well. But like I said, it's really impacting women. And with your insight and what you all have done at Gomo Health for over a decade now, what are some of the key trends and insights you think in terms of reaching women to improve these trends so that we can lower these disability rates? What do you think are some of the key insights to improve women's health?
We're dealing with a population, all of us, men and women, in the aftermath of COVID, where people's lives were affected so significantly, personally, professionally, the education, the social factors that were impacted. So that's big. That's really big. And we're still seeing it, years later with children in school, building relationships. Um, it's such a big thing to get kids away from technology and in certain aspects, and have them realize the importance of interpersonal skills and relationship building for their own social and educational development. Yet, COVID forced that same population of kids to rely on technology for their education because they were remote. A scenario like that. Same with women, same with adults. The so many companies have been all remote. People are not in their culture of their company, and those companies need to build that culture digitally and remotely because they're not in front of their employees. A lot of companies, of course, are returning back to the workplace, but these are different trends. We see a longer lifespan for people. People are living longer now, but they're dealing with managing chronic conditions within that time frame. And we need to build the resources in order to support them and help them navigate their health proactively, educate them on the front end younger. That's a lot of the stuff that we've been talking about. How can we get people to be proactive in their care given this environment? And then in this situation where they do have a diagnosis, where they do have a condition that they need to manage, what resources can we provide to them that they're going to engage with, that they're going to feel, again, build that confidence, build that believability in themselves that I can tackle this, I've got a hold of it. So I think there's a number of factors that are influencing the way that we need to shape the healthcare delivery model for that population.
I think that that's exactly right. I think we look at the data a lot on in front of us and on spreadsheets and whatnot, but when you really see the stories of women, especially at younger ages that have small children, are trying to deal with a professional career and on top of that, dealing with a chronic condition. Just the stress that puts on families and communities is a big reason why we're so passionate at the Insurance Collaboration to reverse a lot of these trends and being having a much more proactive approach than maybe was traditionally viewed pre 2020 is I think a big is very much needed to reverse these trends.
So, let me ask you, at what point would that mom or woman, when would GOMO be made aware that there is a new chronic condition that somebody is dealing with? Through a Q&A, coming through the texting, or are they pulling those records? How do they know that, okay, this person has now had this life-changing event. They're dealing with the new onset cancer, disease, chronic illness. Their children are struggling, and now we got to send them off on that track. Where does that point happen?
So that's a great question, Rebecca. So it happens in a number of different ways. So when we're communicating directly with someone, we have a baseline onboarding that we go through with them to get baseline data. Who are you? Let me learn more about you. Let me learn what's going on in your situation currently. But then things change, to your point. Life changes, factors change, diagnoses change, things pop up. So we do surveying throughout our programs, but we also do, again, back to simple and highly directed, we communicate with people with, say, one question at a time, a yes, no response. Has anything changed in your healthcare situation in the last 3 months, the last 6 months, whatever the frequency of the question is. And that enables us to keep current on what they need because we know there's a lot of comorbidities, different diagnoses, different things that people are dealing with, and things pop up. So we connect directly with our participants and ask them those questions to be sure that we're appropriately supporting them. We have a survey called a How Are You Doing survey, for example, that's delivered along the course of the program, where we get an idea on outlook and depression, anxiety. And our system is built with a very sophisticated logic and business rules so that if we're communicating with you, Rebecca, and for 3 months straight on a scale of 1 to 10, you're feeling like a nine, nine's the highest, and then all of a sudden you respond that you're feeling like a two, immediately in the moment, the system recognizes that differential and reaches out to your case manager or your care team. We call it an escalation, and different people can be designated to manage those escalations. We reach out, it's all automated. We reach out through an escalation and we say, Rebecca's been feeling great, and all of a sudden she's a two. We have a 7 point differential here, letting you know so you can reach out and manage it directly. So there's ongoing, and that's the beauty of the real time and of the technology, because rather than that case manager making weekly or monthly calls to the 200 patients or members that they're responsible for, you have a system that's digitally communicating, triaging the responses, and only escalating the ones that are cause for concern to the case manager to do that one-on-one outreach. So our system enables that scalability across the masses while still keeping it personalized.
That's fantastic.
I love a personal AI buddy. There's nothing better.
Yes, yes, it's the best of both.
Well, maybe it would be beneficial for the audience to see just how it works. I self-admittedly, it took me 2 to 3 times to figure out to really see it up close and personal on how the message-based system works. Do you have a video that you could share the audience on the impact of Gomo's messaging system?
I sure do. I sure do. I have something that I want to share. I had a couple of choices lined up, but I think I'm going to pick this one for you
Great.
because specifically, Mitch, you asked about the participant impact. What's the impact on the participant? So let me show you this.
I'm still learning to communicate with people. These texts give me the support that I need without having to talk. The stories that are sent to my phone let me know I'm not alone and that others have gone through what I have.
When I would get my message every morning, it just reminded me that I was connected to something bigger. It reminded me of the good things here.
In early recovery, like thoughts and feelings are fleeting. And so I may feel like on top of the world at 8 o'clock in the morning, but by 4 or 5 in the afternoon, I don't feel like I'm worth much. And it really is a roller coaster like that. And so Gomo gave me the opportunity to reach out and say, like, I don't know what happened, but I'm feeling anxious again. Normally I wouldn't say things like that to my counselor. I was able to be completely honest with how I was feeling. It sort of puts a buffer there of having to say that stuff out loud.
It's hard for us to say, I need help. It's hard for us to say, like, this was easy for me when I started the military, but now doing this in the civilian world, it's not easy for me, and that's very embarrassing, and I don't know how to explain that, and I don't want to say it to anybody.
That Gomo program just made me have some self-awareness and critical awareness of my thoughts and feelings, and then using the skills I learned through that program and in treatment to get through that, to be able to say, well, yeah, I'm worthy of just anything that anybody else has. But I made it through just because of the skills that I was taught.
Well, Shelley, that is an impactful video, and again, your Gomo Health has been it reaches out to millions of people every day with those impactful stories. And what do you think in terms of women the attention to women's health and Gomo Health's capabilities overall? What do you think some of the concluding takeaways are for the audience to take away?
I really think I mentioned this earlier. I think it's so important to be proactive in communicating with people about their health and supporting them when they might not be at a heightened point of needing it. Because in those moments, they're in a different mental state. They have less anxiety, less pressure, less immediacy, and they can digest and process the information that's given to them and apply it. And then, of course, if we're not so lucky and things don't go as smoothly, we need to have reactive plans. We need to have health management plans that can respond in the moment of need. That's what we call our environment of need technology, to hit people and get in touch with them and really connect with them in the moment that they need it. So we need to be prepared to help people navigate their health at any stage of life and at any stage of complexity. And having that proactive approach and a reactive approach to communicate with them in those hot moments is really where we're going to be successful, because then we'll be touching and supporting everybody.
Proactive to reactive. I really like that, Shelley. If I can think of one or two words to describe our team at the insurance collaboration. We've from the beginning in 2022 when we formed, the need for proactive efforts has been a leading charge of us. So we very much agree with that. Rebecca, any other concluding thoughts before we conclude today?
No, I agree 100%. The preventative need now with disabilities climbing like they are is greater than ever.
The call to action is now. There's no doubt about it. And we're big believers to reverse these morbidity and mortality trends. Is you have to have great partners, and GoMo Health, we can't say enough about the partnership of our first partnership, our forward living partnership with GoMo Health. You all have been tremendous, both from a product side, but also just from a personal and you can tell we wanted partners that felt as strongly as we did about reversing these health trends. And your entire team scales. I want to say the entire country. We've met people from the West Coast. You're based in New Jersey, but based those in Arizona and California and throughout, and just the level of attention that you all have given us to help our mission to save 1 million lives has been tremendous. So thank you so much for that, Shelley, and thank you for joining Pulse of Prevention. We hope to have you back here very soon.
That would be great. Thanks for having me.
Thank you all.